Fraser, what is the biggest problem with traditional depression treatment?
So from talking to a lot of our clients, Mark, I think the biggest thing is they've just been given a pill that they're supposed to take daily and feel better. Um, but with these, they're never actually getting to the root cause, whether it's, a traumatic event, childhood event. So really, I think it's more masking the symptoms rather than actually trying to get to the root cause of why that person is feeling the way they are.
Welcome back to the Odyssey Method with Fraser Johnston. Fraser is the founder and CEO of EntheoMed, which is Kelowna's premier clinic for alternative pain treatments and innovative mental health solutions in the rapidly growing psychedelic therapy field. Fraser pioneered the Odyssey Method, which is a holistic psychedelic therapy model designed to create lasting change. So, Fraser, how is the Odyssey Method different when coming to treating depression?
So I think one of the main things is looking at it holistically. So the psychedelic experience can be an amazing catalyst. And our brain is in a really neuroplastic state after that session. So what we really try and do is how are we supporting the client with alternative healing modalities that can actually help regulate their nervous system before and after treatment. So things like somatic therapy, breathwork, meditation, yoga techniques, because after that window when we're really neuroplastic, that's where we can really start to embed new behaviors, new habits, positive thinking, and different ways we actually see ourselves in the world around us. And part of it is we don't want people just to become reliant on a psychedelic experience. How can we actually use that experience and then create lasting change in their sober waking life? And the big key we're finding at the clinic is the nervous system is so important. And, we can have an amazing psychedelic experience and, think we're cured for a couple of days, but then those old habits and everything can creep back in. So really, how are we maximizing that neuroplastic window after treatment to ensure that people are creating long-term behavioral change?
Can you get a little more detailed into that neuroplastic window? Like, what exactly are you doing with the Odyssey Method? If someone were to come to like the EntheoMed clinic in Kelowna and do the Odyssey Method, what is that neuroplasticity like? And, what exactly is the Odyssey Method doing with that window?
So great question, Mark. So I think there's a couple of ways we could answer this question. So mainly with Odyssey, we're using ketamine-assisted therapy, and then we're also using psilocybin and MDMA-assisted therapy under the Special Access Program with Health Canada. So the interesting thing is ketamine isn't your classical psychedelic. So it's working on your NMDA system and your glutamate system, whereas your classic psychedelics like psilocybin are working on your serotonin system. So glutamate is one of our main neurotransmitters. So when we have this ketamine experience, we have this huge surge in glutamate in our brain. So that's really what's causing this increase in neuroplasticity. So helping neurons create new connections and potentially connections they haven't made in a while or ever made before. So one thing we're finding is, I'm not sure if you've heard the whole ski slope analogy, Mark. So if someone is chronically depressed, has chronic anxiety or PTSD, imagine a ski slope where it hasn't snowed in 4 weeks. There's these very defined ruts and grooves down the mountain. These ketamine experiences or a psilocybin experience, act like a fresh stump of snow or will shake the snow globe. And that's actually allowing people to start creating these new paths and new tracks in their brain. And that is that neuroplastic piece. So once they have their brain in this neuroplastic state, it is a perfect time to actually create new thought patterns, new habits, new beliefs about yourself, new beliefs about your world, and really saying, how do I want to move forward after this experience? Because we can have a lot of insights and revelations in a psychedelic experience, but they can be very fleeting. Whereas maximizing that neuroplastic window with these other modalities is really how we're kind of capitalizing on that as a whole.
Having friends that have personally, had that struggle that you talked about with like traditional depression therapy and treatment, which is like, here's the pill, try these pills. It does seem really refreshing, to be honest, to like see a new way, because I've heard about the psychedelic therapy field and how it has been like in the news and stuff recently, and starting to grow. So it's kind of like interesting to see the results of like your clinic and how they can actually do that transformation. I think it's fascinating personally.
Yeah, Mark, we always say it's not a matter of if, it's when. So we've been treating patients for just over 3 years now. And, when we first started, there was a lot of stigma and lack of education. But as you said, it's becoming much more mainstream now. A lot more people have done it. And, it's really that kind of word of mouth that's really helping, because a lot of people, we have had, drug education in schools. And a lot of people just tar it with a bad brush where, oh, that's the war on drugs, that'll make you go crazy. But when you're doing it in a medically supervised setting and you are well prepared and you do have the integration, that's really where we're creating a strong therapeutic framework, because these drugs can be, abused, much like alcohol can, even caffeine can, nicotine can. But if you're using it in that kind of safe therapeutic model, that's really where you're creating these beneficial outcomes, because we are controlling the environment where, rather, if you're a recreational setting where a lot of people will try psychedelics, all of your awareness is going outward. You can be very overstimulated, whether there's music, conversations with friends. But in a therapeutic setting where you do have the eye shades and headphones and medical supervision, it's creating a sense of safety that is actually allowing that person to explore their inner world and their nervous system. And that's where a lot of the gold lies.
How long do these sessions last?
So ketamine
And
assisted.
specifically, like, in how long is the actual session? And then how long are the like benefits that people experience? Like, how long does it work for, essentially, until you need to come back for another session? How does that work?
So for ketamine assisted therapy, the ketamine experience is around, I'd say, an hour to an hour and a half. And then we usually say this therapeutic window is anywhere from kind of 7 to 30 days, but everyone is very dependent. So we've had some clients who'll see maybe once every 6 months, and they're like, hey, this is a perfect maintenance schedule for me. I still feel great. I'm doing my yoga, my breath work, my journaling, I'm seeing my therapist. And whereas for clients that are potentially a little more, severe, or have struggled for a long time with depression and anxiety, we could see them do a series of maybe 3 treatments within 1 or 2 months. And then that will start to space out over time as they start to get a handle on, their mood condition.
And what about like the risks of psychedelic therapy? And are there any sort of risks that have been associated with it? What does I know you mentioned you have access, a special access permit from Health Canada. But yeah, what does that look like? What is those risks?
So in terms of, risk, Mark, for us, any sort of active psychosis, for ketamine, high blood pressure is actually one of the contraindications. And strangely enough, people have to wean off Ozempic for 7 days before too, just with the interaction there. So the biggest thing for us is really making sure we're walking people through the screening process. And I think that's one of the big things people genuinely worry about is, am I going to go insane? Am I going to lose my mind? But that's the thing, is working through our mental health and our physical consult, we do make sure those people are sound of mind and physically safe for treatment. And that's one of the biggest things, is in a psychedelic session, you can go through a whole range of emotions, but it's knowing that, hey, I am safe, I am looked after here, there is a medical team here, and knowing that whatever's coming up in that session is kind of coming up for you to process and work through. And I think that's one of the big things we see in potentially a recreational setting, is people may start to work through some of these difficult thoughts and emotions that have maybe been buried for a long time. And because they don't have the right therapeutic support, that's where you can have a bad trip, quote unquote. But we always say at the clinic, there's no such thing as a bad trip, because they can actually be some of the most beneficial trips that you'll have, with some of the greatest learning outcomes too.
And Fraser, with the Odyssey method, this psychedelic therapy, what for like medical professionals are a part of that process? Because I know you talked about how holistic it is. So what sort of medical professionals are involved at each stage?
So we have a psychiatric nurse doing our intake, and our medical doctor will do the physical consult. So that will actually be the same physician you will see for treatment too. So we really like to build that continuity of care there. Our therapists are all psychologists, psychiatrists, or masters of clinical counseling. So super well qualified in the field, and they've all done their own psychedelic-assisted therapy trainings as well. Our nurses are all ACLS trained RNs and also ACLS trained LPNs. So that's your advanced cardiac life support. So really making sure at all corners we have a multidisciplinary team, as we call it. So each case we review as a team, and really making sure that person is getting the best support.
Right. And if someone's interested in, going through that intake and seeing if they do, meet your requirements for them, they can use the link down below this video. But what does that process look like when someone comes to like be, evaluated from you guys?
So yeah, first step, Mark, for us is, everyone will get the discovery guide. So there's some awesome information in there. And we also do offer a free 15-minute discovery call. So great to be able to learn about your circumstances and see if you're a fit for the model. And also happy to walk you through all the ins and outs of treatment. And really from there, it's that first step of getting the referral from their family physician, a walk-in clinic or a telehealth platform, because that referral from the family physician will really help us keep that continuity of care. And we also get a really good background on the client too. So we do make sure with every client we work with, we do actually send notes back to the referring physician as well, so that everyone that's part of that person's care is in the loop on how they're actually changing and going through this process too.
And then if you're watching this video on YouTube, consider commenting down below and getting the conversation started. If you have questions for Fraser or anyone on his team, let us know what you want to see and hear down in the comments below, and we'll be sure to check in on them and answer all of your questions. And then subscribe to the Odyssey Method with Fraser Johnston on YouTube, and we'll see you in the next video.